Hi, I'm Noreen. I'm the Pathology Lab Manager here at DHS. I am here to explain to you what we do on a daily basis. First off, we process all the tissue biopsies that are collected here in the endoscopy suites. When they are delivered here into pathology, the first thing we do is accession them. They are assigned a surgical number that will follow the case from beginning to the end of processing. After that is put into our LIS system, it is then taken to the grossing table where the tissue biopsy is grossed, which means that we describe it, we give it like a color consistency, if any margins need marked, we take care of it then, we bisect polyps, and we place them into these little cassettes that will have the surgical number written on it. The lid is placed on it and it's put in this basket. Then from here, it goes into the processor, which takes approximately 12 hours. So an overnight run. So when we leave for the day, it gets put in here, and then in the morning around 6 a.m. it comes off. During this process, it goes through varying grades of alcohol, which dehydrates the tissue or removes the water, getting ready for it to be infiltrated with xylene, which is probably what you smell when you come down here. It smells like a paint thinner. And then once that process is done, it gets infiltrated with paraffin, like you have when you go to like paraffin dips at salons and things. From here, after it is done processing for the night, it comes to the embedding center, and this cassette is then opened like this. The tissue is placed in here from the night before, is taken out of the cassette and put into this metal mold. And it is oriented in here so that when the pathologist views it on the slide, it is correct and he can view the entire field of biopsy. The cassette is then placed on top of the mold, put on the cold plate, and once it has cooled, it forms a block which allows it to be put onto a microtome and cut. Now this process is where we take very thin tissue sections, at 4 microns, it forms into ribbons and is placed on a water bath. And then we pick it up on a slide and the tissue section looks like this. And then from here, the slide is then placed on a rack, and it is put onto this stainer. Now this stain is a routine H&E, which is done in most pathology labs. And the H stands for hematoxylin, which is purple, and the E stands for eosin, which is like an orange-pink color. And once this is done, all the slides are then cover slipped and placed on a tray for the pathologist to view. He will go in and look at it under his microscope, and from here, if any additional stains are needed, we will perform them if we do them in-house, and if they're ones that are more rare or uncommon, we will send them off to a reference lab.